The first severe Canadian case of H1N1 flu lies in an Edmonton hospital today. My information is that this is an elementary student, and this raises questions about what is being done, what is being communicated, and why parents, teachers, and the public are being kept in the dark about this. Minimizing panic is important at a time like this, Mr. Speaker. Hiding information, as some administrations have found around the world, increases people's anxiety unnecessarily. To the Minister, can the Minister tell us why parents at the school and the public are being kept in the dark about this case?
The Honourable Minister of Health and Wellness.
Well, Mr. Speaker, I think I've said on several occasions in this House that it is important that we all show leadership and don't make comments that could be seen as an overreaction. Mr. Speaker, we have an outstanding Chief Medical Officer of Health who's working with the Federal Public Health Agency and other provincial governments. There is a strategy in place across Canada. The advice of the Chief Medical Officer of Health is that the information that has been made public is appropriate, and as I'm sure the Leader of the Opposition would appreciate, in a situation like this, we should be taking the best possible professional advice that we can get.
The Honourable Leader.
Thank you, Mr. Speaker. Well, several schools in BC and the United States have closed in the last week around cases of H1N1. Can the Minister explain the guidelines for school closure in Alberta?
The Honourable Minister.
Mr. Speaker, I won't say any more from a health standpoint. That was not the advice we were given by the Chief Medical Officer of Health, but I would ask the Minister of Education if he would choose to supplement.
The Honourable Minister.
Mr. Speaker, we've been in contact with the school board involved and also, of course, taking advice from the Chief Medical Officer of Health and following that advice appropriately. The information that we're given is that this is not a circumstance where it is necessary to inform others in the school. There aren't, at this point, there is not an indication of risk.
The Honourable Leader.
Well, recently, senior public health officers resigned from this government in protest of government policy that does not support their work in this province. Does the Minister now see the downside of a weakened public health system?
The Honourable Minister.
Well, Mr. Speaker, I've said on several occasions that you can spend all your life looking in a rearview mirror, you can look out the windshield. We prefer to look ahead. We have made an outstanding choice in our new Chief Medical Officer of Health. He has shown through this particular set of circumstances very strong leadership. We have brought through in this particular session some significant amendments to the Public Health Act which strengthen that act, and I think we have an outstanding public health system moving forward, Mr. Speaker.